right now is anybody that hasn't got anything to eat, there's food in the back there on the back table. We want to open up for questions, comments.
Yeah. What makes a person go from sickle cell trait to the full-blown sickle cell?
It's a very good question. You actually cannot go from sickle cell trait to full-blown sickle cell. The sickle hemoglobin is half inherited from your mom and half inherited from your dad. If they are both trait, there's a chance you'll get, so trait means they have one normal hemoglobin, one sickle hemoglobin, okay? And so you can either get the normal hemoglobin or the sickle hemoglobin from that parent, and the normal hemoglobin or the sickle hemoglobin from the other parent. If it's such that you get the sickle hemoglobin from each parent, then you have sickle cell disease. If you get a normal hemoglobin from one parent and a sickle hemoglobin from another parent, then you'll have trait. If you have trait, almost certainly you will not know it. The only really standard problem that people with sickle trait have is they may urinate more than normal. And they won't, how do you know what normal is? So I think that's a big potential to help people understand the issues better, is saying to young adults, you may have a child with sickle cell disease even though you feel great, if you don't know your trait status. So if you have trait and your partner has trait, by random chance, 1 out of 4 of your kids may have trait. And it may be all of your kids have trait or none of your kids have trait, but on average 1 out of 4 will. Have disease.
I know it's hard for us patients that do have sickle cell to find someone who does, know exactly what we're going through to talk about. And I feel that these meetings and events and groups that bring us together, it helps a lot more than we tend to think. And I really do appreciate, all of the assistance that you guys have given us. I mean, I know I've not been a A+ patient, most of the time, but but I do appreciate everything that you guys have done and all of the things that you continue to help us with on a daily basis. Thank you.
That's it. And I think as a community, Cleveland has been really good about doing that, and Campaign Kindred Spirits is totally to your credit that you guys have done this.
Well, thank you for that. It's by God's grace that we're able to do it because most of us have the disease, and we're kind of the older ones, but we do what we can. And actually, there are quite a few sickle cell support groups, family groups, all over the United States. There's a lot going on. What we need to do here in Ohio is we need to get active as patients. Adrian and I and another woman from the support group went down to the statewide sickle cell conference Saturday. And there were the people from Ohio Department of Health who are head of the sickle cell. We have a state sickle cell agency. We have local agency, American Sickle Cell Association, that does the testing. And that any positive test, to your question about the trait, anybody since 1985 in the state of Ohio that was born in the state of Ohio was tested at birth. Your test results, if you came back having the disease or the trait, or if there was a question because the blood's taken when you're you're an infant, and so you still might have a little changeover happening in your blood, your parents were called and contacted. There are 6 sickle cell regions. The state's broken up into regions. American Sickle Cell Anemia Association, which is the paid agency, has social workers that are to find those patients, parents, and get them counseled. If you had the trait, your parents received a card. When I had my son, which was here at Mac House in 1985, I already knew, and his father didn't have anything, so I knew he would have the trait because both of my genes are sickle. But he got, tested. If you see the newborn screen test is when they prick the baby's heel and drop blood on the card, when they've had babies and seen that, well, they test for many diseases and disorders. Sickle cell disease or all hemoglobin disorders are tested for. All states in the United United States have that now. You should know, as an adult, when you become, or as a teenager, you're becoming sexually active, you need to know what your sickle cell status is.
I can use this hospital as an example, but what I'm about to say happens around the country. And that there's a distinct difference in care in terms of quality of care when you're an adult, when you're a child versus as an adult. For some reason, there are some healthcare providers that consciously make a decision to treat sickle cell patients differently than they do other disease communities. And that's something we have to acknowledge. We can't just walk around it and dance around it. We have to acknowledge that these things are happening before we can change them. All the new technology, all the new research is beautiful. It's wonderful. It's about time for a lot of it. But it doesn't change the impact having a doctor who treats you differently has on your life. In terms of when you do come to the ER, whether you do show up for your doctor's appointments, all these things have to be understood why the patients sometimes don't show up or why they feel treated the way they are. In the short time that we've been back in Ohio, I've had patients say things like, when I go to the ER, I have to get in my Sunday best with money in my pocket so I can prove I'm not here just for drugs. I can prove if I just needed drugs, I got money in my pocket, doc, I can go buy the drugs. So we still have a long way to go, and what we need to do is start acknowledging these things because they have an impact on care for everyone that's in this hospital with sickle cell and everyone in this country with sickle cell. It's not something that just happens here in Cleveland or just at UH. It's around the country. If anyone doesn't believe that, just go on YouTube.
Yes.
But the point is, we've got to acknowledge these barriers to care, because if we don't, these things are not going to change. The issue of these admissions goes back to some of the same things that we're still having problems with now. And that's some doctors believing that a sickle cell patient's crisis lasts 3 to 5 days. And once you're admitted, after the second day, they start talking about, oh, you're in your crisis for your 3rd or 4th day, we need to be preparing you to leave. And then that starts with another problem with weaning down off of these IV meds to oral meds so that you can go home and not have to come back before your time because you never should have been released in the first place the way you were released. So there's a lot of issues that need to come about and we need to talk about and change, because a lot of this is mental health. It's about the fact that this community is visibly treated differently from other communities, and it affects patients in terms of getting up out of bed and wanting to go and get mistreated again.
Go to USA.gov, it's your zip code, it tells you who your representatives are in the federal government, and then you can go to Ohio.gov and in your zip code, and it will tell you who your local reps are. It will tell you who's on the health care committees within Congress and within the state of health care. If you get on disability and you're not 65, you're shot because you got to wait 2 years for Medicare. So all of that work I did, all of my savings, it's all gone. I had no credit card debt when I was put on disability. I now have over $30,000 in credit card debt just to eat, pay my bills, and my co-payments. This is not new. This has been happening in this country for 50 years. There's thousands out there. Every state has groups like ours. Now has the National Baptist Convention pastors there. They are behind us. She is about to have in a couple of weeks, I believe it is, she lives in Pennsylvania, so she's right near the Beltway where she can go do her ABSI, but she also has DD. She's doing a national trip around to every state. When she gets to Ohio and to Cleveland, I have agreed to be one of her spokespersons here. And what she's got is a company that has made software is being tested. They want to do a test, so they want sickle cell patients to come to. They're going to have a thing there, but I think she's also going to do it online. We do phone calls. She has phone conferences where all of us from all over the country can get on the phone. There are some strong groups, very strong groups in Oklahoma, Texas. Ohio is the main state. You see Obama coming back here over and over again because we have shared ground. He is a powerhouse for healthcare. For us to come to Washington, they said, Ohio, you got to be there. And we Columbus and went, it was 44 of us from Ohio. We had more people at that legislative day, that was 3 years ago, than the other states did. So, any other questions, comments? Yes.
Hydroxyurea. What are the side effects of that?
So I think the risks that I see for patients on a day-to-day level are weight gain. Most people gain weight when they're on hydrea, and I think that's because if the hydrea works, they're no longer using all their energy to make red cells, and instead they can make fat. So people will gain weight very fast. Some people have ridged nails. Their nails would have black ridges. Some people will note change in their skin color a little bit, and sometimes people get rashes. The thing we watch for over the first 2 months when we change doses is whether the dose, because it's not like some drugs where you can say, boom, you get this dose. We have to find the right dose. If we go too high, it can suppress some of your blood cell counts. So that's why we check people's counts very frequently during the first 2 months when they change their dose.
So is hair loss one of them?
Yes, it can. I should have mentioned that. Yes, it can be. We're on it when you conceived a child. It was a horrible outcome, but we just don't know. So if it can be avoided, we tell people to not conceive a child while they're on hydrea, and we help them. We can switch people over to transfusions when they're going to have a child. Whatever we need to do to get through that.
I just want to say thank you for coming out and participating in our event.